Hello folks, in this video we are going to talk when to stop performing intravitreal injections for patients with wet AMD. This video discusses some situations of contraindications of the injections. You may see here 8 topics. Let's start with the hypersensitivity reaction, which has been described rarely in the literature. Some patients develop inflammation after one or several injections with a specific medicine, and antibodies have been detected, lymphocytes antibody. In that situation, injection should be avoided. Second situation is permanent visual loss. When the visual acuity is very low, like 2800 or worse, and it's stable, you may notice that the vision will never return or improve. Patient and you may decide not to inject anymore. I'd like to bring to your attention that wet AMD, unless there is severe hemorrhage, will never lead to visual acuity of counting finger or hand motion. What happens is that you need to give patients some time to use the peripheral fixation. Give them time in the visual acuity chart so they can find the 2800 letter approximately. A third reason to stop injecting is when you see on OCT total damage to the photoreceptors in the macula, diffuse photoreceptor damage. In that case, the vision will never return. And the fourth reason here at the bottom left is when geographic atrophy prevails, and this has to do with the third item of this list, which is photoreceptor damage. Top right on our list is inactive macular neovascularization for a long time. Most of the people use the treat and extend, and once you reach injections every 3 months, for some time, some patients may decide not to inject anymore, and then you can change treat and extend to PRN and ask patients to return or for a monthly visit or every 6 weeks, and then patients don't need injection anymore. Another possibility is when patients experience severe ocular complications like endophthalmitis, retinal detachment, lens damage. Some patients may elect not to inject anymore. Another option is when you document evidence of thromboembolic events after injection with some medicines. In that case, you may consider ranibizumab instead. And the final reason not to inject anymore is when patients and family decide they're tired. Patients who live in elderly daily care facility, and they have, for example, the fellow eye with a pretty good vision. So I discuss here a topic that is not available so much in the literature, and that's what we've been trying to do in this channel, to bring relevant clinical topics in very short videos so you can use in your practice. I hope you like this list of reasons when not to inject anymore, when to stop, contraindications of intravitreal injections for wet AMD. Thank you, see you on the next video.